Hi. First, a bit about myself. I'm a very active 64-year-old. My activities include skiing and snowboarding, biking, hiking, and running. My hips, both of them, were injured in a skiing accident decades ago, and my right hip was replaced 6 weeks prior to my left. The pain in my hips was never with walking. It was only with the use of my legs in extreme range of motion, like getting my foot over the center bar on a bike to go for a ride. It was important for me to find a surgeon that understood and respected somebody with an active lifestyle, because I had expectations of getting back into everything that I once enjoyed. The surgery was in the early AM, and this video took clips of the day from recovery room to home in the same day. So I'm a couple hours past surgery in the recovery room and doing well. Pain is just about a 3 out of 10, and I have my intermittent compression sleeves going, and I have some breakfast ordered, and I'm doing really well. I'm starting to wiggle my toes and ankles after getting a spinal, and my head is clear, no stomach problems. Ice pack on the hip, and that's what the incision looks like. There's just one IV, and that's how they deliver the saline and any medication, like for pain relief. About 3 hours post-op, and I've got good control of my legs, and I just got something to eat. These are the intermittent compression sleeves to help keep the flow of blood going so it doesn't pool, and helps to prevent blood clots. They're very comfortable. It's like a massage. About 4 hours after surgery, I'm still in recovery, and I just got out of bed to use the bathroom. Peeing after a spinal is a bit of a challenge, but it's now working for me, and I got up with one-person assist, and I used my forearm crutches. Now it is 5 hours past surgery, and I just had some tramadol, a pain medication, delivered by IV, and that's the last medication I need by IV, and that can come out. I met with a social worker to go over potential needs at home, like VNA and physical therapy at home. I met with a respiratory therapist who went over breathing exercises to make sure that I fill up my lungs on a regular basis when I'm at home and less active. So now I wait for a physical therapist and an occupational therapist, and once I've met with them and they've determined I'm safe with an assistive device, then I'm clear to go home. I just met with the occupational therapist, and we went over dressing. As you can see, I'm now in normal clothes, the clothes I brought with me, which are comfortable clothes, baggy clothes, easy to put on clothes. But once I could show that I could put on my socks and shoes, underpants, pants, top, then I am now cleared. I had my visit with a physical therapist, and we walked down to the PT room that had stairs, because I have stairs at home. I have 14 steps, so I needed to be convincing that I would be safe going up and down those stairs starting today. So I walked with my forearm crutches to that room and up and down the steps, and then I walked a little bit further in the hallway just because it felt good to be on my feet. But now I'm back in bed. I've got the intermittent compression machine going again. I'm at home on the couch. I have my legs elevated and keeping my ankles moving, keeping my knees moving, and I have ice at the hip. And this ice is constant. There's a bucket of ice water. So it lasts longer than ice packs, but you definitely want to keep it iced early after surgery. And other things that are handy, I've got a gripping tool to grab things without having to move around as much. And I have TheraBand to keep my arms active and strong while I am on the couch. Here are my crutches I ordered on Amazon. They're forearm crutches. Another name is Loft Strand. They have ergonomic comfort grips, which are wonderful. My hands did not get sore at any time. Crutches are more preferable than a walker if you've got good balance because you have a more natural gait and you can use them on stairs. Here's the hand grip, which is awfully convenient when you need to reach for something that's on the floor, especially, so you don't have to bend the hip too far. And here I am walking the first day, and you can see my left foot is going along with the crutches, and it looks like I'm stepping on that foot, but I've only got about 25% of my body weight going down through the foot. Now you can see on the steps how the safest way to go up the steps is to use a railing. So I put the crutch in the opposite hand, and you go up with the good foot first, the stronger foot, which is my right one, which was operated on 6 weeks ago. And I'm putting about half of my body weight through that left foot. And then coming down, you go down with the bad foot, or the one that was operated on. And that the crutch always stays with the operated leg. And then I don't have a railing for the last 3 steps, so I do show you how I am using both crutches, and the same thing, my crutches go down with the operated leg. This is about 1 week after surgery, and you can see I'm not walking with a limp. Although on days where I would be tired or needing to walk a distance, I would use my crutches because I did not want to develop a bad habit of a limp. And I'm balancing on one leg, and you can see my hips stay level. And lastly, I'll show the use of the steps without crutches about a week after surgery. I would choose to use a railing at night or outside on any slippery steps.